Okay, perfect. So, hello everyone, welcome to today's webinar. I'm really excited to have Dr. Karen Gellman with us today. Perhaps you'd like to introduce yourself, Dr. Gellman, and just...
Hi, so my name is Karen Gellman, and I'm a veterinarian, but I have also studied biomechanics. So I have a PhD in animal locomotion biomechanics, and I used to be known as the nuchal ligament lady because I did my dissertation on the nuchal ligament. Now I'm known as that person who's obsessed with posture because I've been studying posture and talking about posture and teaching about posture for the last 20 years, along with Dr. Judith Shoemaker, who will be joining us, I think, on a later webinar. And we teach vets and horse people all over the world about why posture matters, and it's the elephant in the room.
Yes, yeah, it really is, and that's the reason why I've come to ask you to come and do this webinar, because I think it's such an important thing, and yet it's just almost ignored. Or it's starting to be looked at, but yeah, I think it's such an important thing. So what I'm going to do is I'm going to tell a little bit of a story as to how I came about to asking you to come and speak to us. So I'm going to go ahead and share my screen. Dr. Gellman has introduced herself. So today we're going to be discussing hoof morphology, mainly of the hinds, because that's what I've been looking into, and what I've been calling, or what we generally call, camped under posture, which we can clearly see here in one of my cases. Now, if we look at the bottom right-hand corner, we have very poor hoof proportions, which has led to negative plantar angles in this case, and we can see a very distinct camped under posture. Now, obviously, there are implications for the front feet too, with increased strain on deep digital flexor tendon. For my studies, have really been focused on the hind end. And this is something that I'm now dealing with on a weekly basis all around the UK. My journey started with this particular case. Now, this was at the time I was just starting to really look at things more scientifically and started documenting my work. And what I noticed was that the foot, which you can see here, with completely collapsed heels and a long toe, low heel conformation, was getting increasingly worse, despite my best efforts with the trim and the shoe fit, and the horse's posture was following suit. And I started to see this relationship in horse after horse after horse, and started noticing this posture in horse after horse, and realized that it's really very common, but that didn't mean that it was good. And so I was starting to see this link between what I was seeing in the feet and in the posture. And now this led me to question what external influences were involved in this downward spiral that I was seeing. So this is where I started to do the research into the subject. So what I saw in these horses, when we look at the digit, was and is very poor dorsoplantar balance, a poor heel to toe ratio from crushed heels, prolapsed caudal hoof structures. But what you will notice is that in the image of the digit is that the hoof pastern axis is straight. But what I was seeing is that it's straight because of the posture. And this is what I realized was stopping so many of these negative plantar angles and poor dorsopalmar balance being recognized, was that because the posture wasn't being noticed. So I started to question, is this the hoof proportions being responsible for the posture, or created because of the posture? Now I was questioning the increased load on the heels of the foot from the posture, but also questioning, was the hoof creating or at least perpetuating the posture? And now I've come to realize, or come to my own conclusion, which we can delve into, is that it's possibly all three to varying degrees. Now, most of these horses either had or working their way towards having negative plantar angles. what all these horses had, and you can see this is the same horse as the last image, is a camped under posture, which hugely improved with the correction of the digit proportions. So recognizing this link, I started researching what links had been established in literature, and I decided that this was going to be my research for my degree. Now, all of these horses I was seeing also had a plethora of pathologies associated. Now, in my mind, again, the question of causation was raised. What was causing what, especially since I could have a huge effect on the posture with my intervention. So the studies I found were talking about long toe, low heels, or the extreme of that being negative plantar angles. And that's obviously when the heels are so collapsed that there's a negative angle to the pedal bone. Now, low heels have been shown now. Another reason why we can't say that common is good. Low heels are now the most common hind hoof conformation, according to Dyson 2011 and also cited by Clements 2019. So this is a real issue. And the prevalence of negative plantar angles, I'm sure, is not far behind that as well, certainly in the population of horses that I'm seeing. And this here is obviously the radiographic presentation of negative plantar angles. So I continued my research into links between this conformation and links to other issues. These are the studies that I found in my research linking long, low heels or negative plantar angles with higher pathology. So we had Dyson 2007, who alluded to it in proximal suspensory desmitis. Mansman 2010, who talked about its link to gluteal pain. And he was the only study here that actually even mentioned the stood under posture. Pezzanite 2018 linked it to distal tarsal and proximal metatarsal. Clements 2019, stifle, and Wormsley 2019, subchondral injury of the metatarsal. Now, I noticed the posture in all of the cases I had seen, but again, none of these studies really went into posture that's associated. Again, Mansman et al. Touched on it and also expressed the theory that the associated pathologies would extend further into the trunk of the horse along the dorsal myofascial line. But apart from that, he didn't quantify posture, and he only really mentioned it, didn't go into any depth. And he was the only study from that list. Now, when I look at this image I created of the studies, I immediately saw the kinetic chain that Mansman had alluded to along the dorsal myofascial line. Now, all of these studies had linked negative plantar angles with these pathologies in isolation, but it made logical sense to me that they were all connected. And to me, the one logical thing that linked all of these was the posture that hadn't been mentioned by all the studies. So I decided to look into kinetic chains and bite integrity, etc., just as a course of the continued research. Now the main things that gripped me when I was looking at these studies on the subject was the statement that the position and orientation of every anatomical point affects every other. This caused me to surmise that the hoof was the beginning and end of a closed kinetic chain. For me, this had logical implications for the relationship between the hoof morphology, the posture, and the higher pathologies. But this was really looking at things from a dynamic viewpoint. And the studies that I mentioned before talked about different biomechanics being a possible link between the NPA and the higher pathology. But again, I came back personally to the question about statics, about what about the effects of the horse's posture, because that's what the horse is doing for 22 hours a day. So while these studies were questioning biomechanical considerations for NPA with these issues, again, I came back to questioning posture. What I'm doing currently is studying further along the myofascial line to show that the link extends all the way into the trunk, in the hope to start to shed light on the causation. And this is what I've found so far. So I used thermography to find inflammatory processes going on within the body. And I found the same Dyson 2011, proximal suspensory desmitis. I found gluteal pain, gluteal inflammation, distal tarsal and proximal metatarsal inflammation, stifle inflammation. And so I agreed with all those previous studies, but what I also found was sacroiliac inflammation, caudal thoracic inflammation, sciatic nerve dysfunction, and lumbosacral inflammation. The reality is that as I've researched further, I've started to question whether the hoof morphology or the higher pathologies we are finding are primary at all, or possibly all secondary and concurrent to other causations creating the posture. At the moment, conventional medicine seems to question what starts what, the higher pathologies or the MPA. But to me, we're missing the important link, the elephant in the room of posture. So my research is looking to quantify a postural link between all of these things. So in my continued search, I came across the work of Dr. Gellman and Dr. Shoemaker. And because I started to research his influences on posture. So all of this, again, brings us to the question of causality. So for me, posture is an obvious link, and that's why and I'm going to now hand over to you, Dr. Gellman, to first of all talk about what is correct posture, and then perhaps to define what we are seeing in these different postures that I've mentioned.
All righty.
Yeah.
So you had some really great observations, and one of them is what is linking everything here.
Yeah.
And anyone who starts vet school, or even I'm sure in the training of a farrier, you end up taking apart a horse or taking apart a hoof. And the first thing you learn is that it's stuck together really well. It's really hard to do. We were doing, one of Judith's horses died, and we were saving parts for doing teaching, and we had to disarticulate the head from the rest of the body. And it took 5 of us a half hour to do that. So everything is stuck together really well, and everything is attached to each other really well. So what brings everything together? The joints are all attached to, the bones are attached by the joints. The joints are attached to the joint capsule. Joint capsule is attached to fascia. Fascia and tendons are attached to muscles, and all of those are attached to nerves. And there's the kind of nerves that control outgoing motion, they're called the motor nerves, and the kind of nerves that control incoming information to the brain. And those are critically important because without the brain, we are just a pile of muscles and tendons. And we can't do anything without the brain telling us what to do. So it turns out that everything that's relevant about understanding gait and locomotion and the stuff that horsemen and vets are interested in, it has to start with how all those things get put together and how the body generates upright standing. Because if you are not standing, you're not going anywhere. So if you don't have a brain, you can't generate upright stance. If you don't have the information coming in from your sensory systems, which is not just the eyes, the ears, all those things, but also all of the nerves that inform us about where our body is in space, where our feet are on the ground, is my elbow bent or is it straight? All of those nerves, called proprioceptors as a general term, all of those give the brain the information it needs in order to generate posture. Gravity is the thing that brings us all together on Earth. There is nothing on Earth that is not influenced by gravity. So it's this really unifying force for all of us. And the force of weight which is mass times gravity, is the biggest force that we have to deal with in our personal lives and in our horses' lives. So when you look at all those squiggly lines that we biomechanics people generate, the force platforms, and oh, this is what it looks like in the trot, and this is what it looks like in the canter, what you'll see is that those squiggly lines have big hoops and tiny hoops. The big hoops are the ones dealing with gravity, weight bearing. The tiny hoops are the ones dealing with movement, i.e. moving that leg forward and backwards through space. So everything we're doing in our bodies is at all times dealing with gravity. And I don't say we're fighting gravity. I mean, that would really be a losing battle. Nobody wins. Gravity always wins the battle. And so it's good to not think of gravity as the enemy, but gravity is the level playing field that we're all working from. So when your horse is standing around, I mean, you nailed it when you said that the horse is standing for 22 hours a day. One of my research topics is scaling, which is like how big things are in the universe. So it seems like horses are a lot bigger than us, but really humans and horses are kind of close to the same order of magnitude compared to bugs and voles and tiny little things. So the larger you get, the more efficient you have to be about holding your body up in space and about moving, because the metabolic rate is slower for large organisms than for small organisms. So like, have you ever held like a puppy in your hand and you feel the heart go, its heart rate is really fast. But if you ever checked your horse's heart rate, or, you know, like, for instance, you, Yogi, would feel a digital pulse to see if the horse had laminitis. The horse's heart rate is normally around 30 beats per minute at rest. So 200 beats per minute in an animal this size and 30 beats per minute in an animal the size of a horse. It means that there's literally less oxygen funding per unit body weight in large animals. So that's why horses are so efficient at minimizing the costs of standing around. They stand around because they are too heavy to lie down and sit down. A horse lies down for 45 minutes a day for REM sleep. And the reason they have to lie down for REM sleep is that dreaming, somehow, we still don't know why, is really important for resetting the brain. Without REM sleep, we become sleep deprived and everything kind of shuts down. So the REM sleep comes along with an automatic muscle paralysis. So the horse has to lie down because their muscles are paralyzed for REM sleep. But they only do that for 45 minutes a day, maybe an hour. The rest of the time, they're sleeping standing up, or they're standing up and eating, or they're standing up and walking over to their buddy. So everything else that they're doing, other than that 45 minutes a day, is on their feet, bearing their weight, which is massive. Typical horse is, 450 to 500 kilograms. So if everything they're doing is standing up, then everything about how they stand up and move has to be maximized for efficiency. So the skeleton of the horse, as you show in all your pictures, is really brilliantly adapted to that. We have the check and stay apparatus. We have ways in which the joints lock each other. We have a really incredible fascial net, I can show you some pictures later, that attach the legs to the spine in this really beautiful way and inform about locomotion. When you think about it, though, as horse people, we care about what the horse is doing when we're riding them. But the riding them is a teeny tiny influence compared to how much time they're not being ridden. So when you say the elephant in the room, yes, the elephant in the room is what are the influences on the musculoskeletal system at all the other times aside from when you're on the horse. And the brilliant thing about being alive is that we can adapt. We can do what needs to be doing. We can heal. All of those things are built into our systems, but we need to have the right information to tell us about what's needed. So if you live for 22 hours a day on a concrete pad, and then you go to do a jumping course for 40 minutes a day in very deep sand, your body will not be adapted to the work that you're trying to do. So we like to have as much consistency between the forces that are informing the body how to grow, where to put muscle, where to put bone, how to orient the tendons. Those all need to be oriented to the most prevalent stimulus. And that's why posture is important.
So my understanding of the ideal is, now every horse will have biological variation. They'll have different length of bones, different angles to their joints. But I think what you're saying and what we're establishing is the ideal of vertical metatarsals. Now, because when they're in this orientation, like you were saying, gravity is the biggest thing we have to deal with. They are counteracting gravity most efficiently, right?
Yeah.
And they're bearing load in pure compression. And when they're camped under, they are subject to shear forces. Now that's just the bone itself. And it's interesting you said about the muscle system, because Dr. Rombach discussed the proprioceptive misinformation from poor posture and the loss of preparatory stabilization by the deep muscles, resulting in the splinting effect of the superficial muscles when it was wanting to initiate locomotion.
I would change that a little bit. The posture doesn't give poor proprioceptive information.
Yeah.
Poor proprioceptive information gives the posture. So the brain has a complex system of integrating, sometimes we call them reflexes, but really they're unconscious processes. Yeah. So like a great example is this. I have slides of this. We can just do it. So when the animal's foot contacts the ground, right, so here it is coming to the ground. First thing that hits is the toes, right? So here's the ground. Toes hit the ground. And as it hits the ground, it extends this joint here, right? Extension of the most distal toe is the signal to the brain that a supportive surface has been contacted. So if you do nothing but extend that toe, all of the supportive muscles of the spine and the head and neck, as well as the extensor muscles of the legs, will turn on. And that is for stability while bearing weight.
Well, talking about stability while bearing weight, that brings me on to another point that I wanted to discuss, and that is the use of the stay apparatus while in abnormal compensatory posture. Because from what I understand, the horses can't utilise their stay mechanism properly in abnormal compensatory posture, which affects their ability to rest. Then also they're using mobiliser muscles to maintain posture, which fatigues those muscles. So they have minimal rest with muscle fatigue equals a reduced performance and an increased risk of injury because everything's already being constantly overloaded. And for me, this is a big reason as to why posture is so important. But I'm sure that you can expand on all that for me in a much better way.
Oh, Yogi, you have certainly opened up a can of worms with that. Or is it a wormhole? To explain about standing up and posture, I have to back up a bit to help us understand what posture is. Let me try to condense about 10 hours of teaching into 10 minutes. So biological organisms, whether it's humans, horses, whatever, they're complex systems. We're made up of countless little parts that work together to create the whole, and then the whole organism has what we call emergent properties that are based on those interactions. Emergent properties can be intelligence, learning, behavior, but they can also be posture and locomotion. So the central integrated state, as we see on this slide, of the neuromusculoskeletal system is an interaction between the structures, which are bones, tendons, and ligaments, the function, which are the muscles, and the control, which is the nervous system. And among these, if we go to the next slide, Posture and locomotion are emergent properties of that central integrated state, and the different parts have different roles. So the structural parts, which are the bones, tendons, and ligaments, those are passive because they can operate without any input or energy from the other two parts of the system. Whereas the muscles are an active part of the system, and they have to have both direction and information in order to work. So the control of the postural system is something we're going to talk about a little later, but all three of them are going to be interacting at all time, and the modifications that are available allow the animal to survive their environment by being responsive to changes in the environment. So if we look at these in the horse, this image is one that I use to teach the biomechanics of supporting a beam against bending forces. We're not going to go into that now, but it gives us a good image of the bones, which are a critical passive element for a large animal like a horse. So the tricky thing about being a large animal is that your metabolic rate is slower than that of small animals, which means that you have less energy per unit body weight to do your business. So passive elements are critically important the larger you get. So as you referred to just a moment ago, the check and stay apparatus of the hind limb and the horses are a critical part of passive support, and they are engaged either in a bony or a ligamentous way. So the check ligament is interacting and working against each other to keep the leg stiff, and the stay apparatus can lock the knee into position so it doesn't need to be held with muscles. Now you have to remember that on the horse there are very few muscles below the level of the trunk. So when we talk about the passive structures in the horse, we have the bones, the joints, the ligaments, which are really important because they're completely passive, and the thoracolumbar fascia, which plays a huge role in transmitting energy between the limbs. But then we have more active structures, which are the muscular structures. Muscles are active stabilizers, and they can follow instructions from the postural control centers in the CNS to respond to the external environment as needed. So how can we maximize the effectiveness of the passive structures and use the active structures like the muscles, which are costly, in the best way possible? So one of the ways we can do that is to position those passive structures so they can do their job the best. So how do we support a load? We're going to use the model of a table. The simplest way to support a load on a tabletop is to have your vertical legs like we see in the table on the left. And that takes advantage of the material strength of the structure of the table, the wood, in the way that it has been put together. So when you're making a table leg, you do it with the grain vertically, just the way the tree would be supporting its weight. And that gives us the ability to have a really high load in compression without having the system fail. So you don't have to make a table like that. You can make a table with the legs splayed. And this has a better advantage too, because with a splayed leg, you have a wider base of support. So that can give more stability. But when you have legs that aren't vertical, you may need some bracing to hold them in a non-vertical position. So you can do anything with structural support, but it's going to cost you. So here's a table that has no vertical legs, but in order to support its load with no vertical elements, it's not using constructure, it's not using compression, it's using tension elements in between rigid elements. So it has all these little bits holding it together. So you can do anything you want as a biological organism, but it's going to have a cost. So here is an animal standing on 2 legs instead of 4 legs. And this is a moment in time. This is a canter pirouette, and it's a 1 moment, but every moment of movement is a quasi-static moment of posture, of stability while standing. So this movement requires stability, balance, and poise. But the horse and rider are relaxed and attentive. They're not straining to perform something. So accomplishing a goal in the real world is not necessarily about strength. You don't have to make muscles strong in order to do something. So building on this concept, I want you to understand that posture and locomotion are the same system performing in different ways. And every step contains a moment of stillness. And here we see a picture. This is the Great Secretariat caught at a moment of beauty where he's galloping and there is a single leg supporting the entire horse. So on the right, this is a squiggly line that represents the forces of a horse on the ground. Now, I'm not going to go deeply into this, but I want to point out two things. The higher levels of this, the big curve, the big upside down U on top, those are the vertical ground reaction forces. And the smaller ones are the horizontal ones. So those are the forces in the direction of travel. So I want you to notice that those smaller forces only go to 2 newtons, whereas the higher forces are almost 10 times the amount. So the forces in the direction of travel are an order of magnitude smaller than the forces required to support weight. This is critical for you to understand about horses, is that most of the work of being a horse is supporting weight, not moving. Now, the second thing I want you to notice about this is that there is a line 0 here. That line is whether the force is negative or positive. So a negative force in the direction of travel would be a decelerating force, a stopping force, whereas a positive force in the direction of travel is an accelerating force that makes you go faster. So when you transfer between a braking force and a propulsive force, you have to pass through 0. There's no option other than that. That moment when the leg passes through 0, stopping deceleration and going to acceleration, that always coincides with the highest forces. So when that leg is vertical, like the way you see here, those are the very highest forces that are on the leg. So why is this significant? The reason that we care about this is injury. Injury does not drop from heaven. Traumatic injury happens when forces exceed the strength of the tissue. So the likeliest time that horses get injured is during high-speed locomotion. How can we give those tissues the best chance of resisting the high forces that are experienced during mid-stride? So the best way to organize your body to resist those forces is to use those body parts in that position as much as you can, which means the postural time of standing, which is 20 hours a day or more. So on the right, you see the picture labeled normal neutral posture. Those limbs are in the same position with respect to the body and with respect to the ground as they are during the peak forces of locomotion. Bearing weight in this position will strengthen and align all of those passive tissues as well as the muscles for this job of supporting the leg during the 20 hours a day that the horse is standing around. By contrast, in the picture on the left, the abnormal compensatory posture, the limbs are no longer aligned for weight bearing and compression. So you can do that, but just like that table with the crazy legs, this means you need extra forces to support it. But we know that we need the system to be strongest with vertical legs for maximal weight bearing. So in order to stand in any other position than vertical legs, we need to recruit active elements that can be altered on the fly, which means muscles. So remember, we have the passive components, the ligaments, the bones, the tendons, and we have the active components, the muscles. So how can we use muscles to allow us to have effective and efficient posture and locomotion? It turns out that muscles are not all the same. And you probably knew this, but one of the easiest ways to think about it is light meat and dark meat chicken. So dark meat chicken is kind of redder and it tastes bloodier, and it also has a lot more connective tissue. Whereas white meat, let's say the breast meat, that is the pectoral muscle of the chicken, and that's a flight muscle, and it provides power. So very broadly speaking, we're painting with a broad brush here. How do we differentiate between the different jobs that muscles have to do for the animal? In very broad terms, I'm going to talk about force-generating muscles and power-producing muscles. So a force muscle is going to have short fibers that are slow oxidative fibers. So oxidative fibers are the ones that use the oxygen from blood in order to power them and to help them do their job, which is to contract those myosin tubules and get everything contracting. The force-generating muscles also have a lot of connective tissue. The connective tissue are passive functions, so they help this kind of muscle be less costly to operate. And force-generating muscles are connected to long, stretchy tendons that allow the system to store strain energy in the tendon and then release it for inexpensive power. These muscles tend to be deep, and they tend to be postural muscles and are used to stabilize the animal while standing, as well as that mid-stride during locomotion. But the glamour muscles are the power muscles. Those are long-fibered, fast glycolytic fiber muscles. So another way to think of this in terms of white meat and dark meat is just the fiber type. That's type 1 oxidative versus type 2 glycolytic. What if we thought about a cut of brisket versus a beef tenderloin? So with the brisket, there's a lot of connective tissue, and it's only tastes good to eat if you cook it for a really long time to break down that connective tissue. Whereas the tenderloin is tender, long muscle where you don't have to chew up any of that nasty gristle. So the long, fast fibers have the capacity to actually really shorten, because the amount that any muscle fiber will shorten is how many sarcomeres there are in series. It tends to have simple architecture so that it can have these longer fibers, and it tends to be attached to a short, stiff tendon that can transmit that power. So these muscles are on the surface of the body, and they are better levers for powering muscles, because the further away they are from the center of rotation, the less work it takes to have more power to move it. In the horse, we have a lot of places where this interaction of elements have a system redundancy built in. So one of my favorite ones is in the masticatory system, but it's a little easier to see in the digital flexor system of the distal limb of the horse. So let's take a look at this. So the microarchitecture, the structure of the muscles, can be simple or multipinnate. So the amount of force that a muscle can generate is the cross-section of the muscle, and the physiologic cross-section is perpendicular to those fibers. So if you have a simple muscle that only has two compartments, the way we have on the left, those compartments have less ability to generate force, but the longer fibers have more ability to generate power. If you look, this is what it's like on the short head of the deep digital flexor muscle. But when you look at the superficial digital flexor muscle, we see that there are many, many compartments, and each one of them has only very short fibers. So the great thing about short fibers is that you can just turn them on. All they have to do is contract isometrically, and then the work of the locomotion, the weight bearing, loads the stretchy tendon attached to them with strain energy, which can then be released as soon as the foot leaves the ground. So this is the way it looks in the horse. We've got 3 layers of tendon. We have the superficial digital flexor tendon, which is the one that's most on the surface. Then we have the deep digital flexor tendon, which is attached to the deep digital flexor muscle. And then we've got the suspensory ligaments, which are 2 parts. There is the interosseous, the interosseous is in the front leg. This is a front leg model. So we see that those are only attached between the front and the back of the leg. The pink thing here, right? And then we've got the accessory ligament, and those are completely passive stabilizers that are not attached to any muscles at all. If you look at what these muscles are like in real life, this is a cross-section on top of the superficial digital flexor tendon, and you can see this is just like a beef brisket. It has many compartments with short fibers. Now, the long head of the deep digital flexor muscle has a hybrid function. Part of it looks like the SDF, and part of it has much longer fibers and fewer compartments. And then the short head of the deep digital flexor tendon has very long fibers in a very simple structure. This is the power muscle that transmits the protraction of the leg, getting that leg off the ground, from the deep digital tendon itself, which is a very strong, non-stretchy tendon. So injury happens in this system when there is a mismatch. So if you have part of the system designed to be operated inexpensively with passive mechanisms and part of it for power, what happens when your power muscles fatigue, like, let's say, on a sloppy track? When you have a compliant surface, so let's say running on the beach. If you run on the beach, you want to run on the hard part of the sand because then you can load your tendons and have that extra energy. If you run on the soft, sandy beach, it's going to take so much more muscular work because your tendons can't load, so you have to use only muscle to propel you. So when that happens, let's say in a horse doing high-speed locomotion, if their deep muscles, the active muscles, fatigue, then the passive muscles, the semi-passive muscles, have to take up more of the load, and that's what can lead to the problems because they're doing a job that they're not meant to do, and that's why a bowed tendon is almost always the superficial digital flexor tendon. So, going back to our big picture here, why is abnormal compensatory posture a problem for the horse? Well, I can tell you in so many ways, but here is a very simple thing about the limb position, which is where we got into this with Yogi, that the limb position is less than ideal when you can't use the bony parts like the check and the stay system to stabilize it. So, if we look at the forces on this leg, so you know that there's going to be vertical forces, right? The vertical forces in this horse standing still are not aligned with the vertical extent of the leg. So there is a combined force. There is a complex force that is on a diagonal instead of being straight up and down. So the diagonal forces are a combination of vertical forces and horizontal forces. So we see here the front legs are retracted the way they are when a horse is pushing forward. So that force is pushing away from the level of travel. And on the hind leg, the leg is coming forward as if they are in the first part of the gating cycle. And so we see that we have somewhat of a balance between the two horizontal forces in this horse while it's standing. So we have them balanced, so that imparts, the fact that the horse isn't moving. So if the horse had both going in the same direction, they would either be moving backwards or forwards. So these two are balanced, so the horse is standing still. But in order to impart stability, because now we have a very narrow base of support. So to provide stability and to keep those legs from continuing to fall into the direction they're heading, we need to apply a force to stabilize them. And we see that the caudal thigh muscles of the horse, the big butt muscles, are in the right position to keep that leg from going, the back leg from going forward, and the pectoral muscles are in the right position to keep the front leg from continuing to go back. And you see in this horse, you see how those muscles are large and well outlined. So those muscles, which are muscles of movement, those movement muscles are acting during standing posture to keep this horse from falling down. That is inappropriate. Those muscles are not designed to be used all the time. Those fast twitch muscles are best used for phasic activity, which is turn on, turn off, turn on, turn off, because they are glycolytic muscles. If you use up all your glycolytic energy, then you either have to have the muscle fail, or you have to use lactic acid to build up. So lactic acid buildup is when you fatigue. So the horses who have to stand like this for 20 to 22 hours a day are overusing their muscles of movement for standing around. So here is another view with a different horse, and we can look at all the different problems that happen when a horse is standing in that position. So we can see on the butt, you see how those muscles are outlined. They're working too hard and they're tense and sore. Also in the front, in the pectoral muscles and the shoulder muscles, those are working too hard. We see that the back is using its movement muscles, the longissimus muscles, in order to stand up because it has to counterbalance the narrow base of support on the bottom. So that means the head ends up being too high and the butt is too far tucked. So all of the movement muscles of this horse have been recruited for standing still. And when this happens over a long period of time, we believe there is actually change in the muscle tissues themselves, that those muscles try to become stabilizing muscles by increasing their content of slow oxidative musculature. That's something that our further research would like to look at. Now, this same horse, when you look at the feet, which is where we came into this discussion, we see the real genesis of the most common distal foot injuries in horses, the most common syndromes we see. So in the front legs, navicular and bowed tendon are the most common front leg injuries, and we see how the way the horse is standing puts too much leverage on the toe and too much tension on the ligaments behind, and that's going to compress the navicular bone, and the compression will actually starve it of oxygen. And on the hind foot, we see that there's too much weight on the heels of the horse, and those heels, overly weighted, will start to deteriorate over the long term the caudal hoof structures like the digital cushion and the frog, and that leads to negative palmar angle, which is where we came into this story. So this is the exact same horse. I think it was 10 weeks later in our study, and you really would not recognize this as the same horse. Now, of course, she doesn't have the shaggy winter coat anymore, but this horse is now standing with vertical legs, and all of those muscles that were in the previous shot that were all tense and hard, now they're soft and relaxed. The lowest point of the back is right behind the withers, and there's a straight support line in the back up to the tuberous sacrale, and there's a flatter angle of the croup. The neck is relaxed and long, and this is altogether a horse who will have a lot easier time being a horse than what she was standing like in this picture here.
There's a circular loop that can be a negative feedback loop between poor posture and incorrect or distorted proprioception. From our work of looking at posture over many, many years, we've identified that the very act of domestication, of having animals live with us, and in the case of humans, living in cities and not working out in the fields all day or hunting and gathering all day, all of those things have systematically distorted some of the important structures that give input to the brain about how to stand up straight. So in particular, what's the difference between a domestic horse and a feral horse? So a feral horse is out there. They have usually a 25-mile range that they go through. They have to go great distances for water, for food, all of those things. And some of the tracking devices they put on horses say that they generally put on about 20 to 30 miles a day in their wandering around. They're going to be encountering a variety of substrates under their feet. They're going to be moving and escaping from predators. That's the wild horse lifestyle. Then you go to the domestic horse. The domestic horse, if let's say it's an urban domestic horse, somebody who is in a stable in London so that people can get to them easily. So they're going to live in a stall. If they're lucky, they'll get turned out, in a very small paddock, probably the size of your apartment, for a couple of hours a day. But they're mostly standing in a very limited area with a very limited substrate as the stimulus from their feet. Their feet are going to continue growing because they're alive, so they have to depend on you, Yogi, to trim their feet.
Yeah.
And another thing that is particular to herbivores is that because they are meant to eat, things growing in the ground, and they pull them up, and there's both silica in the grasses themselves, and there's the dirt that's in the roots. So their teeth have to be able to actually grind up the food and not wear away and have nothing to grind with. So cows and deer and all kinds of herbivores are designed to have teeth that continually erupt and wear away throughout life. And you see this when you look at the skull of the horse. So even in that little picture from my business card, you can see the teeth are way up in the cheek of the horse. And as the horse eats throughout life, they wear down the teeth and more erupts down. So if you've ever had a really ancient horse, like, one in their 30s or even 40s, you know that they can barely chew hay. You have to give them hay cubes or maybe some mash because their teeth have literally gone extinct. So that's another area where horses are dependent upon humans to keep their mouths normal, or to try to keep their mouths normal, because a horse who lives in captivity, they get hayed, a couple of times a day. Maybe they get some grain. It's really different from what a horse who is making their own living would do. A horse who makes their own living grazes for 20 hours a day. And that 20 hours a day of grazing is going to affect the teeth really differently. So when a horse lives in a domestic situation, the teeth are going to be quite different. And then the third thing that, is our list of ways in which proprioception goes wrong when you're domesticated is that we lead horses around by halters and bridles. And we do all these things that end up, whether inadvertently or on purpose, yanking on their heads. So really important information about where their head is in space can be adversely affected by external forces. And that external force is you. You're holding on to the lead shank, you are holding on to the bridle, the bit. Anything that you're doing can possibly exert an external force on everything that's holding the head and neck together. And turns out that what holds the head and neck together is the most important input about upright posture and the information that the brain uses to find its body in space.
So you're going to go through all those slides shortly, aren't you?
Yeah, I can show you where it is, but the important thing to remember is that the brain, we're so lucky now in the computer age because we can kind of visualize it. The brain is the supercomputer that is integrating all of those subprograms. So there's a subprogram for moving your leg forward. There's a subprogram for turning to look at somebody on the side. All of these subprograms are integrated in the brain, and they export activity, movement. So when you have poor information coming in, you have poor information going out. And people always say garbage in, garbage out. And that's what happens when a domestic horse has structures, i.e. their feet and their dentition, that are giving bad information about the environment. Posture is how we can interact with the environment. So here's something I thought of before that I really wanted to make the point of about the vertical limb.
Yeah.
So you talked about the skeletal function, and that this comes into like really basic mechanics, that when you have weight bearing, loading a tube in compression is one of the best ways to get a really high weight supporting on a very small structure. So the metacarpal and the metatarsal bones are well known, as to anatomists, as being the thickest bones in the animal kingdom, right? They're really thick and they're really straight. So they are definitely designed to be loaded in compression. So when you look at our biomechanics data, or squiggly lines, one thing that is absolutely consistent is that the highest weight-bearing load, so the top of that big curve in your ground reaction forces, the most weight-bearing occurs when the limb is straight. So if you combine your kinematic, your visual, with the force plates, you say, aha, highest force is when that limb is straight up and down. So that tells us that straight up and down is the optimal weight-bearing position for the limb. And we're talking in broad strokes here, not in minutia. So yes, I know that when the metacarpal is straight up and down, that doesn't mean that the radius and the shoulder are straight up and down. But those bones are in a different function in the body. So if nature is telling us that straight up and down is the optimal position for resisting higher loads, then straight up and down will be the optimal position for resisting the load of non-movement weight bearing for long term. The thing that makes it how we have the leg at maximal weight bearing makes it how we have the leg for the largest quantity of weight bearing. So straight up and down is our standard, that is our neutral. And I've got a lot of pictures to demonstrate this. So this is a bunch of horses who live a great lifestyle on one of the mountains in Italy. I don't know if they're Lipizzaner or something like that. And you see all kinds of horses. They're young, they're old, there's foals, there's older horses. And in this picture, you see that not a single animal is having a hard time telling where down is. Every single one of them has their legs oriented no matter which direction they're facing. Their legs are oriented perpendicular to the center of the earth. So the postural control system doesn't just say, oh, you need to be vertical to the ground. It means you have to be vertical and aligned with the forces of gravity. And so you see that even in foals that are very, very young, this is something that innate in their body knows how to do and process. So without any other kind of pernicious influences, this is the default, standing upright with respect to gravity.
And what's really interesting, if you see the guy who's the only one chap who's standing, not eating, in the kind of center top of the page of the picture. Can you see my marker?
You mean the chestnut?
This chap here, yeah. It's interesting to see because he's obviously standing on a hill, right?
Right.
And it's interesting to see how those front limbs have camped under, but they are still perpendicular to the surface of the earth.
Exactly.
So that's, very interesting.
So there's not a single way to stand.
Yeah.
But the way that we stand has to be coherent with the forces on the body.
Yeah.
So the problem with what we call abnormal compensatory posture is that those postures are not coherent with gravity, and non-coherence with gravity has a cost, and that cost is tissue damage.
Yeah.
So looking at that constellation of lamenesses, those are all the product of long-term chronic compensatory posture where there is a mismatch between the forces on the body and the way the body is integrating those forces. So now, if you look at horses, pictures of feral horses, you're going to see the occasional limb that doesn't conform to this. But that's a moment in time, whereas statistically, when you look at the horses over time, you're going to see that when all other influences are not there, they're going to be standing upright with respect to gravity.
Yeah.
So here's a picture of wild horses out west somewhere. You see the mountains. This is the environment in which horses evolved. And every horse in the picture has vertical legs. Horse family. And look at the surface that they are walking on. I mean, this is like moon rocks. It is hard, it's scrabbly. And yet, if you look at the hooves on that horses, they're tiny, short little hooves. This is a family where we have several generations, and you see the little foal and the yearling and the next one up. And notice how not only are all of their legs vertical to the ground, And they're not going, ouch, 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 because they're standing in some horrible, ground surface. But their spinal contours are all the same. Every single one of those horses' backs looks the same. And that's because this is normal. There is a default. That's normal. Now, I love this picture as an example because this is an example of when it goes right for domesticated animals. So this is an image from the 1920s, and it was a shepherd somewhere, probably Nevada, Utah, something like that. So here we have someone who spends all day long in the saddle. And both the horse and the person have perfect posture. Because you know what? When you do it for 12 to 15 hours a day, you don't have a choice. Exhaustion brings you to a neutral posture. So this brings up the point is that it's a lot harder to have abnormal posture than it is to have neutral posture. Neutral posture is the absence of having to have your body held into place by active muscular work. This was one of those wildlife parks in Florida. It's called Lion Country Safari. So they have a lot of acreage and the ground is sandy. And they had big herds of zebras. Also, they had, all kinds of other, hoofstock, antelope, elephants, all kinds of animals like that. And I took my son here when he was little, and we went to one of the shows afterwards. And I was chatting with the naturalist who was giving the show. I said, it's like, wow, your zebra, they're great. What's your farrier program? And she just kind of looked confused. I said, do you trim their feet? She goes, oh, no, we don't touch their feet. So in this created natural environment, these zebras, which are just another variety of equid, they figured out how to move enough to make their feet be appropriate for their lifestyle in that environment. These guys don't get piles of hay. They don't have to just sit around one area. They move all through this, 50 square mile area. And so it just shows that taking care of horses isn't something that humans invented. Horses figured it out on their own. So a hoof reference to zebras. When I was in graduate school, we would have a weekly meeting. We called it the form and function meeting. And in that, people would bring in topics. We'd have papers. We'd look at different things. And there was a visiting professor from South Africa. And he said, it's a funny thing. When you look at zebra feet, they don't look a lot like horse feet because the frogs are really big and they take up most of the foot. And they're really bearing weight on the frog, and we don't see that in horses. And at that time, this was 25 years ago, and I'm thinking oh yeah, wow, horses are really different. And through the process of the next years, I've come to realize it's no, horses would not be different if they were living a normal lifestyle. I have a picture of a feral horse foot, and it looks exactly like what he described the zebra foot looks like.
I mean, obviously they have these zebra feet are more donkey shape, but in terms of proportions and stuff, right, of the frog and the
right.
Yeah.
Right. So, we have as humans, so why do horses get shot? We started shoeing horses in the Greek and Roman days,
Right.
and that's for soldiering. Horses who work in the field, they don't need shoes.
Yeah.
Horses who are going on the brilliant Roman roads and have to go all day long, they're going to have a mismatch between the wear on their feet and the growth rate. So in order to accommodate that mismatch between the wear and the growth rate, we put shoes on them. And
Right.
The easy way to do shoes is to put them around the rim of the foot. But that doesn't mean that the rim of the foot is the weight-bearing area. And that, I think, is one of the problems with how horses' feet change when they're shod, is that they're being shod to have a limited area of weight-bearing, whereas the foot is designed to have 100% of the foot be weight-bearing.
Yeah.
And that really makes a change for both what goes to the brain as far as information and what how the foot grows, and all the changes and adaptations it makes to weight bearing. So this is our image of a feral horse foot. This foot is owned by one of my colleagues, Dr. Kathy Backus. She lives in Utah, and there are a lot of feral horses in where she lives. It's a high desert country. There's a lot of mountains, there's a lot of rock, and the feral horses, a lot of times they just come and wander onto the roads because, you know, they're looking to go through the dumpsters and stuff like that. So this particular animal was hit by a car, and Kathy went and stole a foot. So what you see in this foot is the frog taking at least 60% of the weight-bearing area. This foot is plastinated, so there's some changes that you see with it.
Yeah.
Then you see, can you see my pointer?
Yes.
Okay, so here is where the lamina is meeting the sole, and this is what we call the white line. And in domestic horses, have you ever seen such a tight white line?
No.
No. This is normal. This is normal. What you see when you're trimming, you know, and shoeing 10 horses a day is really abnormal. This foot, as I said, the environment that this foot lived in, making a living, you know, going however many miles a day, the environment this foot lived in was a very dry environment. And in this foot, you see that from the white line, it's almost like the edges have all been worn away. And they call that in the trim world a bevel.
Yeah.
So the sole, so right, this whole area here is the sole, and that's doing a lot of weight bearing. And the frog is obviously doing a lot of weight bearing. And the wall here has actually worn away. Now, having the wall not touch the ground is an adaptation for this environment where a hoof is really, really hard. Now, if you take a horse who lives in an environment I live in, which is mud 3 seasons of the year, and you take away their hoof wall on a barefoot horse, they're going to be crippled lame because that foot is a softer foot and it's having different mechanics on a softer environment than what we see in this foot. So we can say, oh, this foot is ideal. Look, this is a feral horse. It's ideal. No, it's an ideal foot for this environment.
Mm-hmm.
And so we can't necessarily translate all of the lessons of what makes a healthy foot in the deserts of Utah into making a healthy foot for the pastures of Lancashire.
Yeah. I mean, it's very interesting what you said about, because this is something that I talk about a lot in my articles and in my posts, is about how shoes reduce the functionality of the foot in terms of its biodynamics, as in the way it expands and contracts, etc., etc. And the thing that I talk about a lot is non-frog contact, mm-hmm. because that takes away a lot of the hemodynamic mechanism. And the weight count, we were talking about gravity, it takes away the frog's role in providing a ground reaction force in counteraction to the descending body weight. Whereas when you've lifted it up on a shoe, then everything is able to fall through the middle. So you lose all of that contact area. And it's interesting because this is from a study by Jenny Hagen et al., Dr. Hagen, and it actually shows you the pressure plate imprint of a shod foot versus a barefoot. Mm-hmm. And straight away we can see how there's increased pressure around the rim, but not only that, the whole of the middle of the foot is not having any proprioceptive input, and is not being loaded. Whereas if you look at the barefoot, you can actually see the imprint of the frog there, and it just shows you the difference between what the horse is receiving and feeling, and also obviously a larger area means a reduction in pressure as well. So all of that's going to have an effect on the morphology of the foot.
This is a fantastic lead-in to talking about like some of these proprioceptive mechanisms that control posture. So, you know, you and I were talking about this, and one of the big influences to the image that you just showed, where it was the full foot on the ground versus the rim shoe.
Yeah.
So, if the foot on the ground, that is the interface with the environment that a terrestrial animal is experiencing. And in order to understand what's beneath us, in order to make the proper adjustments and not fall on our face and be dinner for a lion, then the animal has to be able to perceive what's underneath them. And so part of the perception of, obviously you can see it, but there's also what does it feel like, because maybe you won't see that there's, you know, a pebble or whatever. So if you put your two hands together like this, you can feel like, you know, just kind of like rub them together, and you feel all the different pressures that are on them, right? So what if you like move your right hand up and your left hand down? You can feel how it's actually kind of, don't actually move them, just kind of try to move them, but keep them stuck together. So what you're feeling when you do that is a shear force between those two skin surfaces, and the shear force is signaling the proprioceptors in the skin about what's going on there. It's like, oh, there's pressure there. So the sole of the foot has a dynamic map of proprioceptors throughout the sole of the foot and the frog. All of those, it's just like what you felt in your hands. Those are all proprioceptors that are going to respond to shear forces, and they're going to tell how much pressure is on that part of the foot at that moment. And that's important information. So let's say that, you know, you're stepping on a stick. Either you adapt your posture to not, you know, to that particular form, or you could trip, or you could fall down, or you could fall over, or you could become more vulnerable. So this is important information about the environment. And it's so important that just like hearing and vision, there is a consistent array in the brain for all of these spatial positions. So if there is an array of proprioceptors for each foot, each of those nerves goes to the brain and has a similar spatial array of neurons that are going to report on where the pressures are. Those pressures are feeding into the postural control system and telling the animal where to put their feet and how to arrange their muscles and tendons and all of the other things so that they don't fall down. So if you take a horse and have it stand essentially only on the rims, the hoof walls, you have erased 80 to 90% of the proprioceptive information about where they're standing in space. So what can a horse do to adapt to that? One thing that they can and probably do a lot is that they turn up the volume on that proprioception on the sole of the foot that's not touching ground very often, so that when they can get little hints, let's say a blade of grass touching it, any little hint can feed into the brain and give them information. So what happens when you try to transition a horse from wearing shoes to barefoot?
Yeah, they become hypersensitive, right?
And suddenly they're like, ah, like that. They say, oh my God, he hurts too much. You got to put the shoes back on. It's not pain, it's sensation. You take a system that has been pulled up to volume 11, and suddenly they're having a correct stimuli on that system, and it's too loud, it's too much. So they need to reorient the receptor levels, and that takes a couple of days. So if you're patient and you're transitioning a horse from shod to barefoot, they will get over that overly sensation feeling and adapt to a more appropriate feeling. And that horse, once they have all the information from their feet, will be more sure-footed, and they'll be better able to do complex athletic tasks.
Yeah, I mean, obviously some horses take a lot longer than a couple of days to transition.
Right.
Now, I mean, a lot of that comes down to obviously the thickness of the structures and those kind of things, because I suppose where they haven't been stimulated and they haven't been used, you use it or lose it kind of thing, right? So, so these structures have not been stimulated for a long time, so that affects both the amount of neurological input, but also the robustness of those structures.
Yeah, but also think about this. So back when I was first starting to, work with hooves and hoof balance, I made like really dumbass mistakes. And one thing that I did is I said, okay, let me come when your farrier's there and we can work together to help this horse have a better hoof balance. And so I would be polite and standing on the side, and the farrier would take off the shoe and then do all the things that they do habitually before trimming in order to have me see the foot. Well, what they do habitually is remove sole. So I had this horse that I wanted to maybe transition to barefoot. I wanted to do this or that. And I stood there and watched as the farrier, by their own habit for doing, their own work, removed, this much sole that might have been really valuable to that horse. And of course, the horse was crippled lame. So, there's just a lot of skill to be able to realize how the structures have been compromised.
Yeah, that's a bit of a toss-up with that one, because in order to create, because obviously when you're putting a shoe on, you have to account for 5, 6, 7, 8 weeks of growth, right? So you need to balance the foot for that day, but also you need to consider balance for the next 6 weeks. But then that's where the difference comes from taking the shoe off to trim it for the application of another shoe, and then taking it off to trim it to transition barefoot, right?
Yeah, and of course, farriers know that. I was a little too dumb to know that. But that brings up another really good point about having horses live with us, which is that because the horses aren't getting enough stimulus exercise, let's just say, in a barefoot horse, they're not getting enough miles on the road to wear their feet naturally, because they live with people and people aren't going to do 20 miles a day because they're working. I mean, this is just the reality of what modern horse ownership is. Yeah. So if the horse is not going to wear their own feet, then the farrier has to trim for the feet. And the farrier is not going to come do a couple of swipes every week. They have a business to run. There is no model in which it makes sense for the farrier to do trimming as a horse would naturally trim their feet. Therefore, we compromise, and the compromise is what it is. I try to convince my clients to go to a shorter shoeing cycle, especially in the spring, because the feet grow the fastest in the spring. Yep. So if we have this compromise where it's like, well, I have to make the horse sound today, but also make it last for 8 weeks, I think 8 weeks is pushing it. I think you can get away with,
I would agree with you 100%. Yeah.
Yeah. So in the winter time, maybe you can get away with 8 weeks, because in the dead of winter, the feet grow a lot slower. When you're talking about, in our temperate climates, and I don't know, we probably have people from all over. In our temperate climates, we're going to have the fastest hoof growth from spring equinox to summer solstice. So during that period, I really encourage people who want to make changes in their feet to trim every 3 to 4 weeks, minimum. And because that's what the natural cycle, the hoof is going to grow that fast no matter what you do. You can't say it, hey, farrier isn't coming for another 3 weeks. You can't grow anymore.
Yeah, no, absolutely. So what I did a little bit of research myself into the proprioception of the foot, because obviously I was understanding from research in your work that that was a factor in posture. And then that's where I stumbled across the work of Dr. Bowker, which I understand you're good friends with. So I'm gonna share this slide and just talk a little bit about my understanding of what you were saying in that regard, and share some of his work, because I think his work is just fantastic. So and then I'm going to turn off my camera. So this is taken from Bowker et al. 2012, and he talked about the hoof as a sensory organ. And obviously his work on the subject is extensive. Now, all of the detail in this image showing the nerves, etc., is not really important. But for the nerd, it's there. But it's very important to understand, as you were saying, Dr. Gellman, that the horse's foot is the primary avenue for the horse to obtain information about the physical features of the ground surface on which it stands and moves. Now, the horse gains access to this information via the nerves and receptors. Again, as you're saying, this is all talked about by Dr. Bowker. These are specialized for sensing specific information that's detected by the foot. And Dr. Bowker then talked about within the spinal cord, the generated nerve activity becomes incorporated into the different reflexes needed for movement, protective mechanisms, and postural adjustments. So Dr. Bowker talks about it in that paper. The wealth of sensory structures need to be activated by the physical deformation of the nerve endings. So we're talking about being able to actually be in contact with the surfaces. And he also talked about they do not necessarily require conscious perception to respond to the stimuli. So these horses that are adapting their posture are not doing it thinking about it. It's an automatic response to the stimuli.
So there's so much really cool stuff that you said there that I want to unpack a couple of things a little bit.
Yeah,
so
please do.
The difference between, so we use words a lot, reflex. So in fact, like for the last 75 years or longer, people use the word reflex about posture. And reflex has a very specific meaning in anatomy. Reflex means that there is a response, a sensory motor response that goes through the spinal cord but does not go in the brain. So for instance, the patellar reflex that a doctor checks, so they tap on your patellar ligament, and without your having any thought process or even without the brain being involved, the leg moves because it's a stimulus. So a reflex arc is really simple. It's one nerve in, one nerve out. Whereas postural reflexes, so I think the word is wrong to use postural reflexes, are really complex. And they are, as I said, complicated subprograms that are integrated together in the brain at 3 or 4 different levels. So there's all these different levels. Now, add on top of that our ability to control our posture if we so choose. So this is really great because we use the word posture when somebody is like pretending to be something they're not. It's like, attitude. Posture is defined in medical dictionaries as attitude. So there is an emotional component to posture that is often overlooked. So let's say you have a stallion being approaching a mare. They will assume a particular posture that is a communicative of their emotional state. And in the same way, let's say, here's a classic example. Do you remember the old cartoons, the Charlie Brown Christmas, and then Charlie Brown was really sad and he'd go like this. And he had all hunched over and his head forward and with the sad music. So we know our emotional state is very often mirrored by our posture. These influences are cognitive in that we can like think a complex thought and have it expressed with like, I'm sassy and I'm great. Or it can be unconscious, so it's just like I'm so tired, just can't go on anymore. So sometimes it's conscious, sometimes it's unconscious. One of the really interesting things that are a big part of this is the autonomic nervous system. So mostly when we think of the nervous system, we think like, the spine and the brain, and we're doing this and we're doing that. The autonomic nervous system is a completely unconscious part of the nervous system. There is no conscious activation, and there are 2 divisions. One is the sympathetic division, one is the parasympathetic. Sympathetic, people know, is fight or flight. Parasympathetic, a very bad way of talking about it is rest and digest. Basically, the parasympathetic is all of the unconscious functions of your body that go on that you don't have to think about. So that's breathing, digesting, repairing injury. All of those things are regulated by the parasympathetic
So I
nervous
know
system.
a little bit about that from studying thermography, because
Yeah.
it controls vasodilation, right?
Right,
Yeah.
right. So the sympathetic nervous system, what is fight or flight? When the animal or person is in danger, they have to access every facility they have for survival. So the sympathetic nervous system, an interesting way to think about this that we can then apply to horses and observe our observation of horses is you've got kids. So
7.
tiny babies, from the moment they're born, if they suddenly hear a loud noise, the little baby will go like that. So they turn back, their heads go back, their bodies crumple in, their arms are like this. So we can do this like as a thought experiment for all of us listening. So if you're sitting in your chair and we want you to, when I count to 3, think that, oh my God, the ceiling is collapsing. And let's just do this as an exercise and don't overdo it. You can hurt yourself. But I'm going to have you act as if you just perceived that the ceiling was falling down on you. Let your body respond to it. So really believe it for a moment. Let your body respond to it. Then hold that position and make some observations. So we're going to do this. 1, 2, 3. Oh my God, the sky is falling. Right, yeah. Okay, so what are we doing? So Yogi put his hands above his head. He's put his head down. So feel how your neck has closed and protecting the vulnerable area of your atlanto-occipital joint. And most of us, our bodies are crumpled in. We're protecting our soft bellies. And our arms and legs are bent and tense. That allows us to be able to run if we need to, right? Okay, now come out of it. Now, the good news is that I didn't have to tell you how to come out of it. Everybody absolutely knows how to come out of a cringe. The sympathetic nervous system, when the body is threatened, puts the body into a cringe. And the cringe is an arched back, a high head, a closed neck, and coming out of the cringe is lengthening all of those parts of the body. So, let's look at a couple of pictures of abnormal compensatory posture, the camped-in posture where we started, and let's see how that relates to the cringe. So this is our classic posture picture that Judith and I have been using to teach with for umpteen years. This is a upper-level dressage horse, and here you see him standing with a pretty extreme camped-in posture. Now, the thing that goes along with that is a really high head and a pretty sharp angle on the croup, right? So his head is high, and that's closing that angle in the neck. Now we have the legs are pointed in, and they are not vertical to the ground. And we have the neck, head and neck held high, and we have a sharp croup angle, and we have almost no definition of the withers. Now, this is the same horse after we fixed the posture. So here's the same horse 20 minutes later after Judith did a functional change in his posture. So we've been talking about structural things that influence posture. There's also functional ones, but this is just a way of illustrating it in a very easy way. So you see that the head and neck is lower, the neck is longer, the metacarpal and metatarsal bones are perpendicular to the ground, and you see a spinal contour where the lowest part of the back is just behind the withers, and then a nice straight line up to the tuberous sacrali. This is neutral posture. And not as pretty a picture, but you can look at this horse and, you know, this is kind of like, he was like a low-level hunter-jumper and nothing special and, you know, not very impressive. And in this session, again, I did manual therapy on him. I did not change his shoes or do anything else to him. So this is the same horse an hour later. And it looks like a completely different animal, doesn't it?
Yeah.
So it's like you almost can't believe that this is the same horse that you saw before. Now, I was really excited, Yogi, at the beginning when you were talking about how you started thinking about posture, about how that picture of the horse with the really bad negative palmar angle,
Yeah.
how when you looked at that radiograph that all of his bones were aligned with that poor posture. So when we look at this horse here, like if I take that before picture and we look at the horse's feet in this. So looking at the horse's feet, they just look like, oh, well, that looks like a pretty, neat shoeing job, right?
Right.
So, nothing special. When the horse stands up straight, you suddenly see how incredibly long those feet are. So see how suddenly, like the feet look insanely long when the leg is normal?
Yeah.
So
Yeah.
I think something that I had never considered before that I'm really excited to talk to Judith about is how much the abnormal shoes are, like the abnormal foot balance is part of the compensation is allowing the body to align the bones correctly, even with that really distorted ground surface contact.
So that's part of my theory on some of the reason why. So it doesn't explain to me why they camp under in front, because they increase the tension in the DDFT. But in the hind end, when they've got these very, very poor dorsopalmar balance, they've got no heel height, they've got very, very broken back hoof pastern axis, and obviously the extreme of it being negative plantar angle. When they stand with a vertical metatarsal, that broken hoof pastern axis is obviously at its worst. But when they bring it underneath them, it straightens the hoof pastern axis because they're pointing the digit. So in my mind, I was questioning, so how much of it is proprioceptive and how much of it is actually creating comfort by reducing strain on the tendons and that kind of thing. So that was part of my thinking to it as well, is they're straightening the digit to create some comfort or less sensation, if you like.
So I think over time we end up with a bunch of negative feedback loops. Right. I think that once you get to the point of having a negative palmar or plantar angle, that foot is in such a mess that they will do anything to, as you said, reduce the sensations. But how did it get there in the first place? I think that ends up being a mechanical response to even the smallest amount of distortion. And sometimes those small amounts of distortion are literally the amount, as we saw in some of those studies that you cited, the difference between the beginning and the end of a shoeing cycle.
Yeah.
So the way that Judith worked this out in her mind, when she was first making all these observations, and this is like 25, 30 years ago, as a horse practitioner who dealt with a lot of really chronic lamenesses. Here, remember the picture of the horses on the hill?
Yeah.
How those legs were not perpendicular to the ground, but they were perpendicular to the center of the earth, right? Mm-hmm. So when the horse is standing uphill, let's say, horse grazing, standing facing up the hill, their front legs, to be perpendicular to the earth, are behind them, right? So what are the proprioceptive signals that they're going to get with their front legs being behind the vertical? They're going to feel an increase in the digital flexor tendon. They're going to feel increased pressure on the toe. So there are all these sensory signals that will feed into the brain that will help them maintain that posture as stable in that leg orientation, right? So that is an adaptation to standing uphill. It's a normal adaptation. So what happens when the surface of the foot, as made by living with us and people or changing the foot, what if standing just like that with the distorted hoof starts telling the horse erroneously that they're standing on a hill? So if they've got a low heel and they've got a too much toe in front of the center of the foot, that is going to start putting increased digital flexor tendon. So the horse will naturally say, standing on a hill, and start leaning forward ahead of that leg.
Yeah.
Well, what if they're on level ground? That's not going to be doable and maintainable if they just keep leaning forward. So the hind end starts compensating for what the front end is doing. So if you do this for yourself, and again, in our training sessions, we go out and we stand on a hill, saying, okay, we're standing on a hill. What do you feel in your legs when you're standing uphill? And so you're going to feel the tension. You're going to feel what your legs are doing unconsciously to stay upright on that surface. So, right? So you're upright, but the surface is curved. Therefore, your leg is not perpendicular to the ground. It's perpendicular to gravity. So what happens if you try to, on the hill, make your leg perpendicular to the ground? Well, you either fall over or you make a whole body compensation. So with we humans, the body compensation you make is you stick your butt out. So everybody should go and get a big book and try this themselves. If you put your toes up on the boot, you will naturally find yourself leaning forward over your feet in order to stay upright. If you try to make the ankle and leg angle at a right angle, the way it would if you were standing on level ground, you're either going to fall backwards or you're going to make a compensation. Mm-hmm. So the abnormal compensatory posture, in our understanding, comes from a set of signals that create the subprogram that's telling the brain that they're standing on an uneven surface. The point of neutral posture is to be able to do whatever you want. When your posture is neutral, you can do anything. You can go forward, back, stand on your head. Anything that you want to do movement-wise has to come from a neutral place. So a great example of this is like, imagine squatting down, or just go and do it now. Squat down, and some people squat on their toes and some people squat on their heels. Just for yucks, squat on your heels. And you'll feel that your whole body is rocking back. Now, some people are better at it than others. It depends on how stretchy your ligaments are. If you have to stand up, you need to be on your toes in order to stand up. So being rocked back on your heels is not a neutral position. It doesn't give you poise. Before you initiate any movement, you need to come back to neutral. So the way we're thinking about this when we're thinking about neutral posture is neutral posture enables you to make any choice you need to in life for movement. And that's why neutral is important. If you have a camped in posture, before you can move, you need to get those legs under you before you move. And it's a disadvantage. Yeah. Apart from all of the disadvantages of how compensatory posture does negative things to all the structures like the joints and the ligaments and all that stuff. So social poise means that you can deal with any situation. Postural poise means that you can make any choice.
So I suppose now the question, now we've established that what neutral posture is and what abnormal compensatory posture is, I suppose now is when we start to unravel what creates abnormal compensatory posture, right? So yeah. Would you like to then explain to us the influences on the difference between neutral posture and abnormal compensatory posture?
So as I said before, posture is a complex process generated in the brain. So the brain takes information from all over the body, it calculates it, it makes the best choice, and the output is posture. So where is the brain? Where is the brain getting the information? And is all the information of equal importance? And no, it's not all of equal importance. But what we've come to understand is that certain kinds of postural information become more common as problems for domestic animals because they live with us. So when people think about like the vestibular system, that's just a blanket name for the postural control system. When people think about the vestibular system, they're often thinking about the inner ear. So if you've ever had vertigo yourself, or if you've ever had a cat with an inner ear infection, they always have like their head tilted. So the inner ear has two structures that are built to perceive the position of the head in space. Now, animals that don't have a flexible neck have much less need for an inner ear. With the flexible neck, we want to know what's happening to the brain because the highest priority of the nervous system is to protect the brain. So what you see in the little image there is the semicircular canals, and that is basically nothing more than an X, Y, and Z axis that has hair cells perceiving the motion of fluid through them. So if I go like this really suddenly, certain of the directions will have faster fluid movement than others, and that will go to the brain as a signal that's interpreted as, oh my God, the head is up and to the side. So that's a dynamic one. The other mechanism is called the otoliths, and that is only in 2 dimensions. It's vertical and horizontal, and the otoliths are little pieces of bone suspended in a gel, and in that whole suspension are hair cells. So if my head is over to the side like this, the horizontal hair cells of this ear will be more stimulated than the horizontal head cells of this ear, and that information going to the brain is processed as what my head position is, right? So the inner ear is responsible for controlling the head position in space. Now, along with that, in animals such as dogs, humans, and horses, which are pretty much the animals we're interested in, the vision is really, really important. So the visual axis is so important that it can override any other signal. And that's why you get these optical illusions. Have you ever been sitting in a train in a station, right? So your train is stopped,
Yeah.
and another train alongside you starts moving, and you felt like your train moved because you had the visual perception of those images sliding by each other.
Yeah.
Another time where you can get that optical illusion is in a car wash, where you're actually not moving, but the thing is moving through you. So our visual axis is so important because we're very visual animals. Horses are prey animals, so they're really oriented towards their vision as well. And dogs as predators are really oriented to vision. So we can have our vision fool us in very many ways, which is why it can be very impairing to lose sight in terms of balance. So if anybody's ever had a horse who's lost an eye, it takes a long time for them to not go around with a head tilt because they have to adapt to the change in their depth perception. So we're talking about the oculovestibular system. So our eyes are really tightly tied into the vestibular system. And the most important thing about that is that we are able to augment our understanding of what is upright by sighting the horizon. Now, sighting the horizon is something that should happen naturally in a natural environment, but when we live in an unnatural environment, it can be compromised. So has anyone ever had a horse who was really bad trailering? They just started freaking out when they were going to get into the trailer, and would, even if it was a short trailer ride, they'd be flipping out and shaking and kicking and all those things. Very often, if you put that horse backwards in the trailer so that it can look out the back window of the trailer and sight the horizon of the road behind them, they will have no trouble at all. Because once you put the horse in a confined space, they can no longer use the information from their eyes to help register their equilibrium. in space. And if they have any compromise to some of the other parts of the system, the visual part takes a greater importance. And there are so many great examples of how this plays out. But the main thing to remember is that the visual can override everything else. So it's a really valuable thing to bear in mind when you have confusing behavioral problems with the horse, is to see whether their vision has been compromised in such a way that is preventing them from having their equilibrium and balancing. So the next slide. There are proprioceptors in every muscle and every tendon. And those are telling, for instance, in the tendons, it says whether the tendon has stretched. And in the muscles, it tells whether the muscle is firing and the shape of the muscle. And all of those at all times are feeding back to the brain about where each of those things are in space. So when the tendon stretch receptors are more highly activated, as we were discussing how the deep digital flexor tendon gets stretched with a low heel and a long toe, that those signals are meaningful to the brain, and the brain processes them in the only way that they know how. So let's say, a horse spends the first 3 years of its life in a more natural environment and learns, as a toddler learns, how to manage its body in a complex dynamic environment. Those are going to be the settings that are in its brain for getting around. So if you start then taking that horse and putting it on the racetrack and putting racing plates on it and having the toes get long, it will still respond to its factory settings in terms of how it should respond to those signals. One thing that's really important to know is that there's a big variety in how many proprioceptors are feeding back depending on the part of the body. And the pole area of the horse, the first and second cervical vertebrae, and the skull, all of the muscles that are holding that head-neck connection together have 500 times the density of proprioceptors as the limb muscles. So the limb muscles are the dumb jocks that all they know how to do is to run, but the pole muscles are really, really important for giving information about where the brain is and how to keep the brain safe. So that's why the pole is more influential than any other area of the body for both posture and locomotion. So go to the next one, joint mechanoreceptors. So in addition to the muscles and tendons, the positions of the bones can be really important to know about. So there are many proprioceptors embedded into the joint capsules, and in joints that are complex enough to have joint discs, like the stifle, the TMJ, they all have proprioceptors within those joint discs as well. So the body's always going to know where the joints are in space. Then we already talked about the next one, which is the palmar and plantomechanoreceptors. So we already talked about it. It's the ones that are on the soles of the feet. And we talked about how there is an array of shear receptors that are, there's an array of shear receptors that are creating an actual map of where that foot is relative to the ground. And you can feel this in yourself. If you stand up, and I can't do a full body thing on the screen now, but if you stand up and let's say you lean over to the right. So the side of your foot is going to have more pressure on it than the inside of your foot. So the lateral side will have more pressure than the medial side. And as you lean over, you can feel your body making all these adaptations. Now, you're not telling it what to do, but if you try leaning to the right, you will find that your torso leans to the left to counterbalance. So your brain knows how to account for more pressure and to keep the brain from coming into unfortunate contact with the planet, as we say. Okay, let's go to the teeth. Now this is one, the TMJ and dental-alveolar joints, this is one that really surprises people. And It's also something that we can feel really well in ourselves. So remember we talked before about how in a natural environment, the horse would be chewing the grass for 20 hours a day, and so they grind their teeth differently than they do when they eat pre-cut forage and grain. So what happens is that the horse's teeth don't wear evenly in a domestic horse, and you can have changes that we call malocclusions. And there are certain kind of malocclusions that are more common. The malocclusions are changing the way the teeth meet, and they also change the way the entire jaw is hung, because the temporal mandibular joints, or TMJs, are holding the jaw, the mandible is the jaw, onto the skull. So there's a really wonderful thing that the brain figured out in us animals with flexible necks, which is that the jaw is always going to be very close to where the brain is. So if you can keep your feet under your jaw, you will keep your brain from coming onto unfortunate contact with the planet. So there are unconscious mechanisms that will change our posture with jaw position. Now, everybody sit down, sit, fairly upright so that your feet are on the floor. And if you just move your jaw to one side, just go like that, and you will see how your body has moved, and you can feel more pressure on your right sit bone. If you're standing, you will feel more pressure on your feet. And going to the left takes about 2 or 3 seconds for that movement to happen, but your brain is absolutely responsive to the position of your jaw. So this is not only side to side, but it's front to back. So if you go and create a stupid underbite, like a Simpsons character, you go like this, or like that, you will find that it tips your body forward. Now, if you're doing this at home and you don't feel these things, it is extremely likely that you have TMJ problems, whether you're aware of them or not, and your body has down-regulated information from your TMJs. Now, fun story about that is if you have poor information from your TMJs, so your body has found that the information from the TMJ is not accurate, so it down-regulates that information, you become more dependent upon the visual axis. So people find this out when they go to, for instance, go on carnival rides. So carnival rides, going on like a spinning thing or a roller coaster, it's fun because it's exciting. It's exciting because you no longer sight the horizon because you've been taken out of that visual axis and you feel like, wow, we're all over the place, and that's exciting. People who are overly dependent upon their oculovestibular reflexes because they've downregulated the information from their TMJs will get nauseous in those situations. Also, car sickness. People who get car sick in the back seat are overly dependent upon their oculovestibular reflexes because when you're in the back seat, you can't sight the horizon. And this is the same thing as I was saying before about the horse in the trailer being unwilling to go in there. So when you have downregulated one piece of information, you tend to default to being more dependent upon visual mechanisms. And that covers the really main parts of the postural control inputs. And there are some extra bits that are there for when something else fails. So this system has so many different inputs because it is so critical to survival. And if you lose any of them, you need to have a fallback position. So as I was describing, in most of us in our lives, our fallback position is the visual system. But there were experiments done long ago, really nasty experiments, where they found that if they took rabbits and completely removed their inner ear, they could still right themselves and become upright by the sensation on their skin and pelvis. So we have a lot of fail-safe mechanisms to make this work.
But in terms of the vestibular organs, the TMJ, and those kind of things.
Okay.
How do they affect limb position?
Vestibular has very little influence on abnormal compensatory posture.
Okay.
There are like common causes for abnormal compensatory posture, by which we're saying goat on the rock, camped in.
Yeah.
So there are common reasons for it, and there are very uncommon ones. And yeah, maybe you could have an ear infection, and that could influence it. But those are very uncommon. Let's talk about the common ones. And the common ones are core proprioceptive influence from the feet, the TMJ, and the upper cervical musculature. Those are the common ones.
Yeah.
So the feet, you understand what it's doing, that it's creating a situation where the proprioception tells the horse they're standing on a hill, so they position the legs of what would be appropriate as standing on a hill. The way the teeth are doing it, so those of you who are able to feel that if you go like this, you tip forward, or if you go like this, you tip back. You'll understand that those influences can be translated to how you stand. So for instance, you could have a horse where, you see the horse and it's got, really long toes, and you fix them, but the horse is still standing camped in. Then you say, well, what's going on with the teeth? So one of the more common things that happen with horses in their mouths, and we can have a whole time to talk about this, is that they have a malocclusion that prevents the smooth AP motion of the jaws. So the horses have to chew, and they chew in a circular motion, and they should be able to move the jaw both front and back. Another thing that is part of our postural control mechanism, if you look up, your jaw drops back, and if you look down, your jaw drops forward. So that free AP motion is part of what is perceived in the TMJ. When the horse has dentition problems that lock it into a particular place, those are a very strong negative feedback loop, because the more they don't have AP motion, the more they depend upon side-to-side motion, which makes those malocclusions deeper and deeper and deeper. So they no longer are able to let the jaw swing forward. And remember, when the jaw is stuck forward, how the underbite makes us tip backwards. So for many horses, the source of their initial compensatory posture is from a dentition problem that has impeded the free movement of their jaw and locked them into a position where their brain thinks something different than reality.
Yeah, because that's very interesting, because I've definitely noticed that as much as I can do with the feet, very often these horses still persist in these different postures. So in all of this, because again, this brings me back to working out, trying to understand whether the hoof was the cause or not. Because often, like I said, once I've corrected the hoof in terms of proportions and stuff like that, sometimes it still persists. So I think it's really important that we understand and remember that the hoof capsule is a deformable structure that is subject to the forces on it from the weight of the horse, gravity, as we talked about before, the ground beneath it, and the way that the horse is interacting with the ground. So all of those things will have an effect on how that hoof grows and how it morphs. And like I was saying, a lot of these horses, they haven't got long toes from hoof growth. A lot of these guys have long toes, or the appearance of long toes, actually because their heels are completely crushed. So we have to understand that often that hoof morphology is being created by the forces above rather than creating it. But that's why it's important that we deal with all three of these different areas that you're talking about, right? Because if I sort the feet out and we don't get the change in posture, then we need to question where else it's coming from.
Right. So I remember in a discussion that we had on Facebook last week, there was a young woman who got really upset that we downplayed the influence of riding on how the horse was functioning. So I like as a biomechanics person, I am differentiating between structure and function. So structures are structures, they're the hooves, they're the teeth, things like that. Function are the active inputs that are going there. So there is no amount of fantastic and perfect riding that's going to change a long foot. There is no amount of riding that's going to change, dentition that is making the horse crooked. However, riding can be a really positive influence for the functional aspects of this big three problems. Remember we said there's the feet, the teeth,
Yeah.
and the cervicals. So there are very often damages, poor proprioception, downregulation in the cervical region, and some of them are from injury or accidents. Some of them are from the way the horse is trained, like, you would have to be living under a rock to not be aware of the controversy about a process called rollkur, where people are asking the horse to bend its neck behind the vertical and using devices to force it into that position. And all of those things, the things that we do to the horse in name of training and making them beautiful and elegant and functional, those things can actually cause damage if you use force in an inappropriate way. So anytime that you're using force to force the neck or head of the horse to do something, you're risking damage to the structures because you're taking it outside of what the brain knows is best for them. So you could have a horse that has abnormal posture, and you go in and you make their feet correct and balanced. And we get an expert dentist go in and make their mouth as functional as they can for that horse. And there could be a postural problem that persists. But now that remaining problem, now that the structures have been normalized, becomes much more accessible to the kind of changes we can make with correct work and with manual therapy. So you have the chiropractor, you have the massage therapist, you have the vet, things that they can do that change the function of the pole region. Those are things that can now be addressed. And I'd like also to put the point in that it's not an instant fix, although we can make it a lot better very quickly. I mean, just as I'm sure you've seen, Yogi, that you can take a horse who's standing camped in and do a prosthetic shoe job on them, and they will stand up straight for the first time in years. Just relax.
Yeah,
and hang their head down. And it's like, oh, thank you, thank you, thank you, thank you. So all of those patterns that have been engaged with the chronic issues are not going to be overridden immediately and completely to a state where you don't have to pay careful attention to them. And what we tell the people we train in this paradigm is that it takes about 18 months to completely reset the system so that it's self-maintaining. And that 18 months involves 2 complete hoof growths. So let's say you walk in on, Wednesday, February 11th, whatever today is, and you correct those feet so that they are now mechanically correct and are giving correct mechanical influence to the brain about where those feet are in space. Now, from that moment forward, all of the new hoof growing will have correct mechanical input and will grow in the correct direction.
That's right.
However, that new hoof is part of a capsule that has significant distortion. And you do your best to remove what distorted tissue you can, to use the shoe to compensate to make things better, but there's still distortion going along with the mechanically correct foot. So let's say that foot grows completely out, and now we've taken away, it's 9 months have gone by, we have removed through growth and wear all of the originally distorted hoof capsule. So now we have a complete new foot that has only grown in mechanical correctness, right? But all of that tissue, all of that hoof capsule has been living alongside of tubules, hoof capsule, and other structures that have been with distorted ones. Yeah. So we need to continue having that complete mechanical correctness through another full hoof growth so that there is no part of the foot that remembers the distortion. And then the foot will be much more easier to maintain, will not tend to have flares, will not tend to have these kind of problems.
It's very alongside what I find in practice is now you said 9 months. That's if you're lucky. with some of these thoroughbreds and shod horses and stuff like that, you need to wait 12 to 15 months for one hoof to grow out, let alone two. So yeah, this process can take a long time, but and like you say, you create by the use of prosthetics a better functioning hoof, but it takes nearly 2 years sometimes to be able to take that foot out of any prosthetics and for it to be self-sustaining, like you say.
To complete the picture that, it's not just the hooves. With the dentistry, in a reasonably young horse, let's say a horse, under the age of 20, during that 18-month period that we discussed, there can be 3 dentistries because we need to keep the teeth functional while trying to correct it. So the 18-month period, ideally, would include 2 complete hoof growths, 3 dentistries, and 3 to 4 postural resets from the functional point of view. And what you want is for the body to be able to reset every season influences on the posture and to be able to have the entire system reset to a neutral thing. So this is an ideal, and I'm sure that you have the experience that many horse owners are impatient to say that it's going to be a couple of years before the horse is perfect. But the thing is that when you make the kind of changes you do, like when you're making the foot mechanically correct using a prosthetic for those really damaged feet, is that the horse is so much better right away. So even if they are not yet perfect and self-maintaining, they're so much better. They feel better. They can move better. They can do everything better.
The thing that we need to emphasize is, as you said, is the teamwork approach to it. Because we've seen the associated pathologies that go along with this, right? From those different studies, we have back issues, hock issues, sacroiliac issues, etc., and if we don't sort the posture out from the feet and from the cause, they just perpetuate.
A lot of times, the kinds of injuries we're talking about, they're like really chronic injuries, and it's really hard to get horses to heal from them. And the reason that they can't heal from them is that they don't have the ability to create a normal compensatory posture to rest the limb. So if that horse, let's say it's got, a suspensory injury in the right hind. I think I was like writing you this series of things. Let's say you have a suspensory injury on the right hind from the negative palmar angle, right? So that horse needs to rest that leg to allow the injury to heal. But if the horse's teeth and if the horse's feet surface and, let's say, stuff in its neck and its brain are telling it that it needs to be standing on that foot, if the horse is unable to generate a stable posture on the other 3 feet, then they are going to continue to stand on the leg when they should be resting it to heal. So pain is a valuable signal that tells us something is broken. Pain does not have any kind of emotional meaning. We're the only ones who give meaning to pain. Pain says, oh, this hurts. I think I'm not going to stand on it for a while. So an appropriate response to injury is to rest the leg while you're standing and to use it when you're moving. And if you can enable the horse to actually have a neutral compensatory posture on 3 legs, like Yogi, when you're working on a horse, if a horse can't tolerate your picking up the leg, there's 2 reasons. One is that the other foot of that pair hurts so much they can't bear to stand on it. But the other is that for one reason or another, they can't figure out how to make an even triangle of the 3 legs on the ground so they can have a stable 3-legged posture.
And that is absolutely something that I see in a vast majority of these negative plantar angle cases that are camped under is the first couple of shoeings, if not more, they struggle to be shod behind. But then as the proportions get better, as the postures had time to take an effect by being improved, then they improve in their being able to be shod. So absolutely, 100%, I see that. Yeah.
So having a stable three-legged posture is really critical to the healing process. Now, in terms of you're struggling to get them to pick up the hind feet and to balance, I told you that Judith, Dr. Shoemaker, who you'll be talking to, I'm sure, in other talks with this, she came to this understanding about posture just through her clinical work and being a genius. And one of the ways in which we spoke about this for years and years, so like when I first met Judith 20 years ago, she talked about that these problems of the long toe, low heels, and the abnormalities in the mouth made what she called a pitch to the rear. So her father was a pilot, so she thinks in terms of pitch and yaw and tilt. So a pitch to the rear, and this seemed like a really good model because in the horses who stand camped in, you always see them having really wide frogs in the back and really narrow frogs in the front. And we know that the width of the frog is dependent upon the weight bearing, right?
Yep.
So her model was that the postural abnormality is a pitch to the rear. So when we set up our research study, we did a study funded by the American Holistic Veterinary Medical Society in 2014. And we went to a facility that had 4 force plates in an array so that you could measure the weight bearing on each foot separately when a horse was standing. So we went to start our study, and first we set up our instrumentation. And I got a bunch of data and came home with it, and I was really excited. And I thought, oh my God, this horse isn't pitched to the rear, because no matter how badly the horse was standing, they were still bearing 60% of the weight in front and 40% of the weight on behind. And I can show you some of these data another time. And it really made our eyes open about what it was that we were seeing, that it was not actually a shift in weight bearing, that physics constrained the horse to always have 40% of their weight in the forelimbs and 60% of their weight in the hind limbs. That's a given.
The other way.
40% in the hind limbs, 60% in the front limbs.
Yeah.
Okay. That way.
Yeah.
So it's constrained. There's no way that that body can do anything other than that. However, when you look at the way the foot is contacting the ground in the camped-in, goat-on-a-rock posture, we see that within the foot itself, that the rear limbs are experiencing higher pressure in the caudal part of the foot, and the forelimbs are experiencing higher pressure in the front part of the foot. And this is totally consistent with all of the chronic lamenesses we see in horses. So in the front foot, we see with long toes, we see navicular problems, and we see separation and flare in the toes. And that is completely consistent with how the foot is meeting the ground. And in the rear, we have all of the crushing of the digital cushion that goes on with the low heels and the excessive loading in the caudal part of the foot. And all of those things come from standing that way. So lameness does not drop from heaven like some unfortunate hailstone. Lameness comes from how you stand 22 hours a day. You and I were chatting by email before we started today about convincing people that posture matters. So what does it take to convince somebody that posture matters? And from my experience in teaching posture for 15 years, is that most horse owners can be pretty easily convinced that it's important because if they see what it does to their horses. So if your horse is standing for 22 hours a day, of course how they stand is going to matter. It's very easy to get too focused on movement because movement is the fun part of being a horse.
Yeah.
But when you talk about the activity of living for a horse is mostly standing. Therefore, that's going to be the prevalent influence on the structures.
Yeah.
So when we see abnormal structures, whether they're damaged or they're just distorted, that's going to come from the primary influence. So, all those things really matter a lot. And
Yeah.
if you are a equine vet and you're worried about, how do I make this lame horse better? I really am here to tell you that the horse will not get better until they can make a stable standing posture that allows that leg to heal.
Yeah, and as a farrier, and I mean that's why I'm studying what I'm studying and trying to show gap in the studies that we mentioned earlier. Is that
talk about that? Oh my
yeah,
God!
Is the fact that what I'm seeing in the foot, the morphological changes that I'm seeing in the foot, is so often, like you said, attributed to what's going on dynamically, when actually should we really be bearing much more attention to what's going on, what forces are acting on that foot while it's standing still for 22 hours a day. So that's exactly the reason and the kind of thinking behind the studies that I'm doing. So I'm really looking forward to presenting those quantifications of the things that we're talking about here. So that's brilliant.
And one of my big rants, which we've done, before, is that when we try to use published literature to understand these biomechanical structures, we're being seriously hampered by there being no standard for the hoof trim. So people are measuring all kinds of interesting things like tendon strain, and they're measuring force plates, and they're measuring muscle activity, but without having a consistent standard where we can say with every one of these variables that the feet were consistent, it's apples and oranges.
Well, and also posture. Yeah, but we know from Kuma et al. 2007, I think it was, where they took a load of experienced farriers and they compared their trimming methods, and they were all completely different. So, so there you go.
I mean, there was consistency between the horses trimmed by each farrier, but no consistency between the way that the feet were done to them all. And until we can, as Judith would put it, zero for feet and teeth in lameness literature, we really don't have much to learn.
Yeah.
So this is why, our work on, doing the postural research is so important.
Yeah. Well, this is why I felt it's so important to approach you guys and to get this out. And that's why lots of my Facebook posts are about trying to get people to start looking at posture. And yeah, I just think it's such an important thing. But so thank you so much, Dr. Gellman. It's been an absolute pleasure. It's been mind-blowing, in all honesty. I've got to probably watch it a few hundred times to take all the information in. But so thank you very much. And I look forward to doing some more in the future, for sure.